Welcome. My name is Babita Sharma. I'm a journalist and a broadcaster, and it is my pleasure to welcome you on the eve of the fourth high level meeting on NCDs to what I believe will be one of the most powerful events at UNGA 80. It is a gathering that's focused on what happens after tomorrow, and by that I mean on bold country and partner commitments to action in financing, reforms, and access to prevention and care. Now, I'd like to acknowledge our phenomenal co hosts and partners today who have made this important gathering possible: governments of Denmark and Brazil, the Coalition for Access to NCD Medicines and Products, and coalition members Access Accelerated, the International Generic and Biosimilars Association, Novo Nordisk, and PATH. Today, we're going to be focusing on a pivotal moment for NCDs ahead of that high level meeting. And as government and partners come together, we're here to really embrace political declarations and, very importantly, and this is crucial actually, to translate them into tangible, transformative action on the ground. I'm really pleased to say that we have a fantastic lineup for you this afternoon. We're going to begin by grounding ourselves in why NCD financing and access is really critical to galvanizing action. Then our first panel today is going to discuss examples of where progress is already being made. And our second panel is going to focus on the role that normative agencies, civil society, and the private sector in driving those commitments and, of course, accountability. And finally, we're going to hear from countries and regional partners embracing the challenge and announcing some very bold commitments, which we're very excited to hear. But to get us started, I'd like to invite our first speaker this afternoon, Sophie Løhde, Minister for Health for Denmark, a country that I'm sure you're well aware is showing remarkable global health leadership at home and abroad. Please join me in giving the Minister a warm welcome today. Thank you.
Now I'm turned on. Now, Excellencies, colleagues, ladies and gentlemen, I'm honored to speak here at this important side event about advancing access and financing for NCDs. And firstly, thank you to our host for convening us here today to discuss one of the defining health challenges of our time: non-communicable diseases and mental health conditions. And let me start by saying the reality is clear. NCDs remain the leading cause of death worldwide. They do not disappear in times of crisis. On the contrary, the challenge will grow if we do not act. In order to handle the challenge of NCDs and poor mental health, we need to do much more, and we need to make much more resilient healthcare systems, because as health needs change, health systems must adapt, not only to keep up, but to improve health outcomes. In Denmark, we are right now reshaping our healthcare system to ensure that patients with NCDs and mental health conditions can access and navigate the system easier. I'm referring to the most comprehensive healthcare reform in decades, a reform aimed at bringing healthcare closer to citizens and their daily lives, a reform that is patient-centered, a reform that seeks to enhance coherence and improve patient pathways. The reform has many different aspects, and I will not go into the full list of initiatives, otherwise I could speak all day, and that is not something to wish for. But at the core of our reform is a strong and accessible primary healthcare sector. As an example, over the next 10 years, we will invest in 40% more GPs, 40%. And meanwhile, we will develop new standards for patients with suffering from NCDs. We call them chronic care packages. These standards will offer a clear, coordinated journey through the health systems for patients with NCDs. For example, imagine a patient who has recently been diagnosed with diabetes. This person will receive a coherent and personalized treatment plan, or a COPD patient who is struggling with flare-ups and who needs seamless care from diagnosis to treatment to rehabilitation. Patients should have the right to comprehensive health services tailored to their individual need, right to access your own data, and right to digital solutions supporting more home care and empowering patient. And that is what these new standards will provide. But reforms alone are not enough. Access depends on medicines, products, and innovation reaching patients. To be prepared for the future, we need to work much more closely together across sectors, across borders. We need collaboration between hospitals, universities, companies, and patients. We need life science ecosystems that foster innovation and ensure that good ideas are scaled and shared. In Denmark, we deeply value the cooperation in our strong life science sector. In 2024, we have launched our third national life science strategy, a push to strengthen clinical research, modernize health data infrastructure, promote innovation, and deepen international cooperation. And it is not just another policy document. It is an all-of-government commitment and a shared roadmap with the industry, academia, and the health system. The aim is to secure faster integration of innovative solutions in healthcare by fostering effective public-private cooperation. The strategy is built on the belief that collaboration is a competitive advantage. But let me be clear today, this is not just about Denmark. This is about a model that can scale, travel, and adapt. In Denmark and around the world, we face many similar challenges, and we each hold part of the solutions. So imagine what we could do if we put those parts together. I hope this important side event here today will contribute to fostering ideas and solutions to the benefit of patients all around the world. Thank you for your attention.
Thank you, Minister Lød there. And for me, I think it's exceptional to point out that you say that this is not just for Denmark, it's a model. And I think that's something that we can really hold true to the fact that if we are going to make concrete change in here, that it is about uniting everybody on this journey. So we're really appreciative of your time. Thank you so much. I'd now like to welcome up the stellar Monique Velde, Head of Global Health, Nutrition and Population of the World Bank, to share her thoughts on financing in the context of NCDs and the World Bank's role as a catalyst. Please give Monique a warm welcome. Thank you. Hello.
Thank you very much to the organizers. I'm really honored to be here, and great to also see this turnout. Obviously, this is a topic very close to many people's hearts. So in the lead up to tomorrow's high-level meeting, we are reminded of the urgency before us. We are living through extremely challenging times. Global growth is projected to fall to 2.3% this year, its lowest rate since the Great Recession, excluding COVID-19. The world's poorest countries face a massive healthcare funding shortage, needing $61 per person annually to deliver basic services, but only able to invest $17 per capita. This is projected to further drop to $15 because of the recent donor cuts. At the same time, we're facing a rising tide of non-communicable diseases accelerating across low and middle-income countries, threatening to overwhelm already fragile health system. This double burden, shrinking resources and growing needs, creates an unprecedented challenge. But here's what makes this moment different. These very challenges are creating also the conditions where health investments can deliver outsized returns. When economies are struggling, healthy populations become the foundation for recovery. When fiscal space is tight, smart health investment create jobs and strengthen resilience. This vision is at the heart of the World Bank's commitment to reach 1.5 billion people with quality, affordable care by 2030. That's roughly a doubling of our current reach. This includes working with public and private sectors on expanding access across the life course, reaching hard-to-reach areas and reducing financial barriers to access. NCDs and mental health are very central to this agenda, integrated components of resilience health systems that benefit everyone. The momentum is already visible in our financing. The World Bank has provided $2.6 billion focused over the last year, focused on expanding access to NCD and mental health services. And this is double from our previous yearly commitments. Just a week ago, our board approved $235 million for the South Pacific, which will connect care within and across borders, including using innovative AI and digital tools to reach remote communities. But financing alone is not sufficient. We need to support countries to build systems that leapfrog screening for hypertension before it becomes a stroke, providing HPV vaccines to prevent cervical cancer, managing diabetes proactively. Every dollar invested is connected to the evidence we have, to operational know-how, and opportunities to adopt lessons across countries and work in partnership with others. We're supporting learning and knowledge co-creation, such as the Financing Accelerating Network through our partnership with Access Accelerated, launched in Africa and expanding to Latin America. We are partnering with key foundations, such as the World Diabetes Foundation and Helmsley, to integrate and scale NCD innovations. We're also working with the private sector to bring care closer to patients. For example, our private sector arm, IFC, is investing in the local production of generic medication to lower the cost and the burden on households to buy NCD medication. Since announcing our target 18 months ago, we have reached 300 million people with quality, affordable health services. But this is not enough. We need to accelerate. The opportunity before us is significant, but so is the challenge. It will require smarter resource use, bold thinking, and stronger partnership. And that's why we are all here today. In this room, we have philanthropies, we have civil society, we have governments, we have private sector, all essential parts of the solution. And efforts must be led to the leadership of countries. And so we are collaborating with countries to develop national health compacts, high-level government-led agreements demonstrating commitment to universal health access. We're also launching the HealthWorks Leaders Coalition, bringing together senior government leaders to lead by example on health access reform. The cost of inaction is staggering. Lost life, lost opportunities, lost growth. But if we flip it, this is an investment in healthier lives and stronger societies. The fight against NCD is not a narrow health issue. It's a development imperative. It's about building societies where people can learn, live, and work with dignity. The question isn't whether we can achieve this ambition of the high-level meeting. It's how quickly we can address the NCD crisis and how many lives we can transform along the way. Thank you very much.
Monique, thank you very much for that. Let's flip it. I think that's so important to understand that the narrative can change, and it's about acceleration to progress, but collaboration. And with that in mind, I think let's talk about collaboration and the importance of partnership. I'd like to invite now Dr. Kimberly Green, representing the Coalition for Access to NCD Medicines and Products and PATH. Kimberly, welcome.
So on behalf of the Coalition for Access to NCD Medicines and Products and PATH, it is my profound honor to welcome you today to an event that is focused on NCD commitments, action, and what is next after the high-level meeting. So very much on accelerating action from this point forward. I would argue that this is one of the most impactful events, and you will discover in a few moments why this is the case, because you will be hearing from governments on their bold commitments towards NCDs and towards mental health. So the coalition is a 22 multi-sectoral membership force that includes countries, civil society, the private sector, academia, donor organizations, and 10 brilliant technical advisors. The coalition was founded in 2017 to act on the major challenges that low and middle income countries face in access to essential NCD medicines and products, and as well the health systems and service barriers that inhibit access to NCD prevention and care. So given the need, we are increasing in our membership. So this year we've increased by 32%. And we're also expanding the scope of the membership as well. So really meeting the moment, understanding where countries are headed and what they need in terms of comprehensive NCDs in mental health. So if you're interested in joining the coalition, this is an inclusive group, and we look forward to discussing membership with you. So this year, with the opportunity of the high-level meeting, but also at the same time with the dire impacts of the abrupt withdrawal of millions of dollars in global health aid, we've galvanized our advocacy efforts around pragmatic ways to, number one, improve financing, to finance more, to finance better, and to finance transparently NCDs as part of strong primary health care, with a major focus on the range of taxation strategies that are available to countries and which many countries are embracing right now. And in addition to that, also, though, looking at creating greater efficiencies through improved forecasting, through improved procurement strategies, but also through systems and service integration, which is very importantly a strong topic this week and is embedded in a very profound way as part of the Declaration for NCDs and Mental Health, which is very encouraging. So a major goal for this year then was to partner with countries and regional stakeholders to advance bold commitments in these areas. So fast forward to June, the coalition met and gathered in Uganda, hosted by the Ministry of Health, at a powerful meeting to discuss these commitments across members, including inviting new members to join DRC, Egypt, and Somalia. So we're so grateful to have you as members. So now here we are today on the eve of the high-level meeting with coalition members and allies, as well as with Ministry of Health representatives from Brazil, from DRC, from Indonesia, from Kenya, from Somalia, Tanzania, as well as a very impactful regional body, the East, Central, and Southern Africa Health Community, who will all pledge bold, courageous, and people-centered actions and investments in NCDs. We're honored to partner with you and, importantly, to be your ally as you implement these historic commitments. Thank you.
Dr. Green, thank you very much for that. And wonderful to see that that collaboration is evolving. So thank you for giving us your perspective. As Dr. Kimberly Green just said, advancing this agenda is really crucial on a global scale. So I think let's hear about that directly from the countries and partners who are translating these visions into action for our first panel this afternoon. I'd like to invite our first group to join me on stage for a moderated discussion. Please welcome His Excellency Budi Sadikin, Minister of Health for Indonesia. Welcome. And also joining us, we have Dr. Leticia de Oliveira Cardosa, Director of the Department of Epidemiological Analysis and Surveillance of Non-Communicable Diseases and Injuries from Brazil. Welcome. We have with us Dr. Susana Almeida, the Secretary General of the International Generic and Biosimilars Association. Hi. Wonderful to have you here. Great titles, by the way. Reading that out is interesting. I can't really underestimate how important it is that we're all gathered in this room, because this is where changes really happen. And by the way, we have a microphone there, so you can just each grab it when we address the question. But Mr. Budi, welcome. I'd like to begin with you, if I may, because when we're talking about health and finance, you're an expert in this division here, and I think leading national reforms to great success. So I'd wonder if you could please share with us a little bit more about the best return on investment for NCD prevention for Indonesia, and also a little bit about the new birthday health screening campaign, which I know that you're very passionate about as well.
Yes, just as a disclaimer, I'm a banker for 30 years. I became health minister only around 4 years plus. So I know banking better than healthcare. So I understand financing well. So when I joined, I realized that many countries spend their healthcare budget differently. Like in Indonesia, every year we spend 40 billion US dollar, which is around 140 US dollar per capita, to reach 72 years average life. And I realized my closer country, friends, are Malaysia, 76 average life. They spend 300 US more, 430. I'm 61, so I believe Indonesian population are getting healthier and live longer. So if in the next 5 to 10 years Indonesia reach Malaysian level, logically we will spend 300 US more, multiplied by 280 million, it will be 84 billion additional expenses. So 3 times larger than the current budget that we have. If we go to the most efficient country in the world, Singapore, 84 years average life, 3,300 health costs per capita, around 3,000 more than Indonesia, multiplied by 280 million, it will be 840 billion additional healthcare burden. If I talk about United States, 11,000 per capita, you trillions of US dollar I need to spend. Trillions US dollar I need to spend. So I take a look at this country. Why some countries, which is most of them spend in NCD, they spend more efficient is because they do more promotive and prevention. So the strategy is very clear, to keep the population healthy, not to cure the population when they are sick. So that is our strategy. In 2022, we increased our vaccination from 11 to 14, including, to most of your surprise, HPV for the first time, PCV and rotavirus. In 2023, I would like to bring today, I would like to accelerate the screening, borrow money from that lady just sitting there for 4 billion US dollar, and
Have
half
deep
of it,
pockets.
deep pocket, half of it I used to upgrade 10,000 primary healthcare clinics to do screening. And then that screening started in February this year. The most aggressive, ambitious program ever. 280 million Indonesians will have mandatory screening every year. Every year.
That's extraordinary.
From newborn until elderly. And then Indonesian hate mandatory. We are a democratic country. So we changed that to birthday screening gift from the president to the Indonesia. So it is a gift. You should be able to take the gift. And to my surprise, now our run rate is 500,000 people every day. We reached 35 million people screened 2 days ago. And to my surprise, hypertension, 20%, 15% blood, glucose, blood glucose, and around 12%, high cholesterol. Now my challenge is, after we realize shockingly those figures, then what will be the treatment? So now we are struggling, hopefully, because when I realized only 5% to 8% are controlled, I want to increase it to 50%. Now I'm struggling how we can follow up with the treatment, take the pills every day, make it controlled, and measure again every month. So hopefully my focus between now until December is to focus on the treatment. And hopefully that will increase the life of Indonesian age, but also with a cheaper cost. Thank you.
Thank you very much. No, please grab it for a second. I just wonder if I could ask you just follow up on that, Minister Budi, if you just want to grab the microphone. There was a conversation about sustainable financing that I know that is being had amongst a number of people here on the sidelines of this. What's your view on that?
When I joined, I have 3 billion budget. I have around 300 million grant every 3 years, so 100 million every year. So those are my source of fund. And I told my team bluntly, we have to have a very clear roadmap how we can be independent, self-finance as a country. As we educate our child, the worst education is to give money to our child forever. It is unbelievable wrong. So that's why I said we have to have a financial pathway roadmap when we would like to get off from the grant, move to concessional loan, and then concessional loan to commercial loan and equity by yourself.
Okay.
So now my funding is I'm sitting on 4 billion budget from myself, 1 billion grant, and 4 billion from her. So and I have more money actually. So I said the money is there. It's just a matter how you change the source of money. Some of money is free, and you cannot forever expect that you will get free money. But some of the money you can pay a very low interest. Talk to her, very higher interest. talk to other party.
Thank you, Minister Budi. Interesting point though, actually, because there's one thing about having your pot full, but it's not always going to stay that way. I don't know if there's any British people in the audience here, but we would talk about what you were saying about the nanny state and warning against the nanny state. Dr. Cardoso, if I can come to you regarding Brazil's experience, because when we talk about a universal health system, it'll be interesting to get your perspective on what you believe lessons can be learned in terms of access to NCD care, particularly through the sustainable financing that we're talking about right now.
Thank you.
Extend this lead for you. There we go.
First of all, I would like to thank the mission and the market to the invitation. And I'd like to make a statement that my minister asked before. Unfortunately, Brazil's ministers of health participation, EU and GA, were severely restricted by the US government. The visa terms allowed travel exclusively to New York, with movements restricted from the hotel to the UN. In addition to medical facilities in case of emergency. Because of these unfounded and arbitrary restrictions on Brazil's diplomatic activity, Minister Alexandre Padilha decided to not participate in the events to which he had been invited. He
Well, we are grateful that you're
yeah.
So thank you.
But yeah. So after this, it's an honor to share with the esteemed audience some of the key lessons of Brazil has learned through the experience of our unified health systems, particularly in addressing non-communicable disease through sustainable financing, effective partnership, and technological innovation. First, we would like to emphasize the importance of the primary care financing model that values territory linkage and the quality of care. Brazil has recently adopted a new methodology that rewards health teams based on qualification of user records and the effectiveness of clinical follow-up. This approach ensures that the resources are allocated more efficiently, promotes continuity of care, and reduce avoidable hospitalizations. And the new financing has three main components: a fixed one for the health team, a second one that based on the quality and best practice incentive components, and also a territorial linkage and follow-up component. I would like to highlight this territorial linkage and follow-up components. It was implemented May this year, and it has many criteria like qualified records, effective follow-up, vulnerability criteria, for example, higher scores for children under 5 and also for older adults and beneficiaries of our social program like Bolsa Família. It is a cash transfer program with many success in health outcomes in the country. And also population limits per team to not overload the teams in the field. And user evaluation that we are implemented in the next months. Monthly funding per team range from 6,000 of reais until 8,000, depending on the performance and the accomplish of these criteria. And the main strategic objectives are to expand the access and coverage of primary care healthcare, promote greater equity in federal funding, encourage continuous and community-based care, and strengthen the primary care health as the main entry point to the system. And the second, we would like to highlight the role of institutional and scientific partnership in expanding the access to medicine and specialists. Over the past 2 years, our unified health system has incorporated 62 new medicine in the public system. Many targets the NCD and mental health. through transparent, evidence-based process by the National Committee of Incorporation of Medicines and Technologies in our system. This committee includes the government, of course, but also civil society members, scientific medical societies, and others. And we have also a program that's called Farmácia Popular, Popular Pharmacy, that is spread around the country, that when the pharmacy can affiliate to the program and people can have the medicine by free. And finally, no, sorry. Furthermore, we would like to highlight the program. Now we have more specialists. That in Portuguese is agora tem especialistas, and we are implementing right now in the country. And we have successfully integrated the primary care and specialized care, reducing the time to diagnose and in many diseases, especially cancer. It's a big challenge in our country. And finally, it's essential to underscore the role of the technological innovation, particularly in NCD diagnostic. One concrete example is the development of a point-of-care diagnostic equipment by a public laboratory of our country that would be able to strengthening the non-communicable disease surveillance and care. The integration of this device into routine in primary care enables rapid and accurate diagnostics, even in remote areas. As you know, Brazil is a continental country, and we have this challenge of to give the access in every piece of the country. So moreover, the data generated by these tools feeds into a research network and the epidemiological surveillance system, contributing to continuous monitoring of chronic conditions and the development of more effective public health policies. These experiences demonstrate that it's possible to advance in NCD care through sustainable, people-centered solutions supported by strong governance and driven by innovation. So Brazil reaffirms its commitment to international cooperation and stands ready to collaborate with countries that share the goal of strengthening universal health system. And congratulations to the news that you bring here. It's very important to improve the public health systems.
Thank you
Thank
so much. I think it's really interesting for you to highlight. For me, what I picked up from there is technological innovation. And actually, I don't think we speak about that enough, given the way that the world is moving rapidly. And I think that to mention that in terms of access to NCD care is vital. So thank you very much for raising that. And also to point, talking about affordable access to NCD care, we're dealing with, between you both, huge populations here. I mean, it is quite staggering. So let's just drill down that on a moment. And thank you for that. Dr. Almeida, I'd like to ask you in terms of generics and biosimilars, how we can expand that affordability when it comes to access for care.
Thank you very much. And thank you to the Danish Consulate for hosting us here for this important discussion. IGBA is the International Generic and Biosimilar Medicines Association. We're the association of associations around the world, and we focus on the needs of patients. We work to improve access to quality assured, this is very important, safe, efficacious, and cost-effective medicines by promoting competition and enabling innovation in the pharmaceutical sector. Generics represent between 50 to 99% of the total doses of prescription medicines across the IGBA markets worldwide. That's really huge. In the space of biosimilars, as of November last year, we had over 1,000 approvals of biosimilars covering 10 different therapeutic areas. Overall, generics represent the lower portion of the market value, usually below 50% due to their characteristic affordability, and this makes them extremely desirable for the sustainability of healthcare systems. Generic and biosimilar medicines are therefore a wise investment in terms of public health. NCDs, we've discussed this throughout this week multiple times, are responsible for a large proportion of deaths, most of them in low and middle income countries. And as the governments around the world grapple with the increase in the healthcare costs, aging populations, and also the increase in incidence in NCDs, it's really important to ensure access to these affordable, quality-assured generic and biosimilar medicines. Significant evidence demonstrates the benefits of generic and biosimilar medicines. They make treatments more affordable. They provide relief for healthcare budgets and enhance patient access to safe, effective, and quality assured therapies. However, the generic and biosimilar industries face a series of challenges, from inappropriate patent life extensions to regulatory burdens to challenges in supply chains, and this puts sustainable patient access at risk. From our perspective, it's extremely important to address these barriers to enhance patient access across the world.
Grateful for that. Thank you so much. And I think the evidence is clear, as you've just highlighted as well. We're running out of time, but I could talk to you all for hours because there is still so much to be said. But we are grateful for you joining us today and having you in this arena to share in an intimate setting. So to all of you, please join me in thanking them all. Thank you very much. Thank you. Well, we are going to continue now with our second panel this afternoon. And we've just been hearing about those country-led initiatives, which I have to say, incredibly inspiring, from Brazil to Indonesia. But let's just dig a little deeper now into the practical solutions. And by that, I mean the commitments that are really needed to foster this sustainable efforts, if you like, in terms of hearing what normative agencies and civil society and private sector, how they can make this happen. So let's find out. Fingers crossed. I think we will. Please welcome the experts to the stage. Herb Riband, Executive Director of Access Accelerated. Welcome to you. We have with us Dan Chisholm, Mental Health Specialist at the World Health Organization. Welcome, Dan. And we also have Dia Satyani Saminasari, founder of the Center for Indonesia Strategic Development Initiatives. Welcome. Hi. Thank you. Thank you. Do you want to just take a seat here? You are very welcome. It's wonderful to see you all here. So much to talk about already. We've only been here for like half an hour, but I think what's interesting is to really reflect on the common challenges in terms of the financing commitments. You know, Monique laid it out, didn't she, very well? And I think that the critical role of communities and civil societies in kind of shaping these discussions. So, Hab, let me start with you. You know, from your work with countries and the priority needs and the challenges, what do you understand to be how Access Accelerated is kind of helping to respond to, you know, what needs to be done?
Sure. Good afternoon, everyone. Let me just introduce Access Accelerated as a unique collective of pharmaceutical companies that have come together to work in partnership with leading NGOs and with the World Bank to help countries improve access to quality NCD care. We go back to 2017, but in 2023, we refocused the partnership on helping countries improve health financing for NCDs. And we do this through a very strong local engagement model. So we talk to countries, we listen to their needs, a collection of stakeholders from government to civil society to others, and then we do our best to try to support those needs. And the way we support it is through a mixture of technical assistance, creating country-to-country, peer-to-peer learning opportunities, and providing catalytic seed funding to help kickstart promising health financing initiatives. So what we did 2 years ago with the team, with Monique's team from the World Bank, and working with Results for Development, we created something called the Financing Accelerator Network for NCDs, the FAN. So remember that. If nothing else you remember from what I say today, the FAN. ncdfinancing.org. And we work in partnership with many organizations, and we work with countries, again, through a local engagement model. And to answer your question, we recently had a cross-country learning workshop in Nairobi, Kenya last month We had delegations from 7 African countries just to talk about where they were on their health financing journey. What's working? What's not? What are the challenges? What are some interesting new ideas and opportunities? And it was a very high energy workshop, a lot of engagement, and it really showed the value of the local engagement, but allowing countries to learn from other countries in the same
Which
region and
is so
compare notes.
important.
Absolutely. And we were very encouraged by that. We'll continue with this model as we expand to Latin America and Asia Pacific. But it's interesting, a number of common needs and challenges were identified. Data systems are weak, they're fragmented, they do not help lead to evidence-based decision making. So can we work on that? Again, we don't need a solution from Geneva or from Copenhagen or from Washington. Rwanda has made incredible progress on an integrated health information system, so countries can learn from Rwanda. But also the need for investment cases, generating more resources for NCDs. But sometimes, as we heard, the money is there. The question is how to spend it
Yeah.
to have the highest impact. So there are a number of things, needs that countries are identifying, and it's our job to work with partners and try to address those needs. And we can't do everything. If countries need help with procurement, we have friends at the IDA Foundation and AxMed who are experts. If people need help with innovative financing models, we have friends at MedAccess who are doing incredible work bringing NCD into the innovative financing mode. So again, our job is to help countries wherever they are on their health financing journey.
Yeah, thank you. And I think I think the Rwanda example you gave there is interesting because we can only learn by what we know and what is shared. So that continual communication is really important. Herb, thank you very much for that. Dan, let's talk from a WHO perspective in terms of strategic actions, that countries can really take to put financing for NCDs on a more sustainable footing. I mean, we're talking a lot about that, aren't we, at the moment?
Yeah, thank you, Babita, and thank you so much to the organizers for the invitation to this event. I actually want to start with talking about an event that took place in 2011, which was around the first high-level meeting. Do you remember that? The Best Buys, NCD Best Buys? Yes. So that's 14 years ago by my calculation. And ever since that point, I think there's always been that looming question about how do we move from political commitment to financial commitment. We know what the Best Buys are and what they can do and what they will cost. But the question is, who's paying for that and how will that money be generated, particularly in cash-strapped or highly indebted countries. So jump forward to 2024, and Monique's getting a lot of references this afternoon, but WHO worked with her team on an international dialogue on sustainable financing on NCDs and mental health. We held it in DC in 2024. And so I can maybe just mention a couple of the kind of key messages coming out of that. If you want more details, there was a nice paper published on Friday by David Watkins and others that gives all the gory details. But three that I think would stand out for me. One would be obviously the sort of elephant in the room. How do we raise more resources? And often in this community, the first reaction is health taxes. So health taxes, fantastic. Win, 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 as we call them. But they're not on their own going to be a sufficient solution, okay, for the meeting the enormous needs for NCDs and mental health conditions. So we need to think a bit a bit beyond that. And one of the kind of key messages from that dialogue was we need to get a bit more smart and think a bit up the chain and think about not just health taxes, but other fiscal policies and measures, perhaps around subsidies, but also financial management, public financial management. So this is one issue around the revenue raising. A second one is obviously a raising, but reducing the prices, particularly of medicines. This is a driving force for out-of-pocket payments. So there's several mechanisms that countries can take to reduce the price of medications, whether purchasing, pool procurement, removing tariffs, which are kind of taxes on the sick, etc. So this is the second one. And then this leads me to my third one, which would be around financial protection. So there is a huge amount of out-of-pocket expenditure, as I said, driven by a lot by medicine. So enhancing coverage policies to bring in more people with NCDs, mental health conditions, and chronic diseases under that umbrella in an explicit sense. I was very pleased to see that in the final political declaration that will be endorsed, hopefully tomorrow, that there is an explicit
It's days tomorrow, of course. Yeah.
there's an explicit target around financial protection for NCDs and mental health. So that's really gratifying to see, and let's hope that countries can step up and make that move from a political to a real financial commitment.
It is gratifying to see, isn't it? I think that's so important. Thank you for sharing that. Dia, listening to that, I'm sure you'll agree about the critical need to center people in this conversation and communities and NCDs access. So how, for you, what does that look like?
Well, I think the design has to start from the people. I think from what has been said earlier, we need financial protection. We need to ensure that people get access to the care they need. We need to be able to identify their barriers, not only in the care, but also in accessing care. So in order to do that, I think it's the key is to shift the perspective. So it's not only from WHO or government dictating, for lack of better expression, or saying and putting it in the policy what the people need,
Yeah.
but hearing the voice of the people is critical. Dr. Kimberly Green and I share the Lancet Commission, where we work for people-centered care for universal health coverage. So the voice of the people with lived experience, is key towards success. To ensure affordability is there, medicine can be accessed, the right medicine can be accessed. And carrying out the people's voice and being the bridge are people like Dr. Green and I, perhaps, and so many others in the room, where we can translate the voice of the people into what makes sense for the government to do the policy. For example, in Indonesia, Minister Budi is spearheading the integrated primary care. So that program or that pillar starts from the communities, not from his office.
Sure.
So that ensures the voice of the people are being carried into policy making paper. And then as such, it can be something that all of you here can learn from. So Indonesia will populate the reference and the list of best practices on how communities can be resilient on their own, and also how communities are able to identify and to say what their barriers are. From one of our research in Indonesia, the demand side research, women, I saw your magazine there, women can be classified into 4 different groups. Women in the cities, women in the rural areas, semi-urbans, and such. Each of them have different barriers that they face as they are accessing care. So that is that first barrier, and then the barriers when they are in care. By grouping it into the groupings in the integrated primary care, so along the life cycle, it classifies people and enables health workers to immediately identify what that population group actually needs. I think that is something that civil society organization and research organization like CISDI in Indonesia can take away and enhance into series of refinement and inputs and gap identification, which we hope we will bring into policy. The government will brought into policy, and also identifying the financial barriers in our journey.
Thank you. You've spoken incredibly eloquently on that. And I think it's so important to have that grassroots perspective because that's what we're all here for. I'm going to be slightly cheeky as I know we've run out of time, but I'm just wondering if I can ask you a very, very quick question. A couple of words to answer if you can. I know that's tricky, but if you'd like to see one thing that shifts this narrative in terms of the commitments that are going to be implemented, what would you want it to be, Herb?
I think these commitments, these declarations need to translate into action on the ground and real action, real projects, real money. I hope you all heard what Monique Vletter said, $2.6 billion in NCDs in the last year. That 5 years ago, that was a dream. That no one could have imagined that. So there are resources out there. There are the best buys. There are many tools. Let's see implementation on the ground. And we in the global community, let's make sure we are doing to support and help, not to try to drive from a top-down perspective.
Thank you, Dan.
Self-reliance is the word I wrote down because if we follow the example of the minister who just left, that's exactly the pathway, isn't it? Because he's looking, the goal is to be self-reliant, an independent self-financing is the way he put it. Of course, with support along the way, because ultimately, if you want to have sustainable financing, domestic financing has to be at the core.
Thank you. And Dia, if we can get a microphone to you, just very, very, very briefly, if we can.
I think communities have identified what they actually need. And I think listening to the voices of the communities, starting from the most vulnerable, is the way to go, which will ensure that the intervention and the self-reliance are on point and on target.
Thank you. Thank you to all of you. I'm grateful for that. Yeah, absolutely. And if that all happens, then we'll all be okay. So fingers crossed. Thank you so much. Yeah, thank you very much indeed. Thank you, Herb. Now let's turn our attention to really the heart of the event, which is very much about country and regional partners in making specific commitments to that financing and access for NCD. So first we're going to hear from Minister Samuel Roger Kamba from the Democratic Republic of Congo. He will provide his remarks in French. For those non-French speakers among us, I'm going to provide an English summary. Minister Kamba, welcome. Thank you.
D'abord, merci beaucoup de nous avoir invités ici. Et c'est un plaisir pour nous de parler de ce problème de maladie chronique qui est un shift que nous sommes en train d'observer dans notre épidémiologie en Afrique. Nous sommes souvent avec les maladies transmissibles qui sont le plus grand fardeau que nous avons. Mais nous avons maintenant de plus en plus de mortalité aussi liée aux maladies non transmissibles. Et nous arrivons en RDC autour de 34% maintenant de maladies non transmissibles qui tuent. Donc ça veut dire que nous avons une grosse remontée de cette problématique. Alors nous avons décidé de prendre des engagements pour pouvoir résoudre ce problème. Et le premier engagement que nous avons pris, c'est vraiment les soins de santé primaires que nous avons décidé que nous allons étendre les soins de santé primaires. Parce que nous avons été beaucoup dans le diagnostic et dans le curatif. Nous n'avons pas été beaucoup dans la prévention. Et donc, maintenant, le premier engagement, c'est d'abord la prévention dans le cadre des soins de santé primaires. Mais pour y arriver, il y a deux bras. Le premier bras, c'est les travailleurs eux-mêmes. Et le deuxième bras, c'est les solutions qu'on leur donne. Alors, nous avons décidé, nous avons la chance pour ça, que nos médecins, nos infirmières, nos travailleurs peuvent encore être des salariés. Donc, nous avons décidé que tout le monde va être seulement salarié. Comme ça, il n'y a pas de soins à l'acte. Parce que les soins à l'acte, ça coûte très cher. Et donc, nous avons décidé que tout le monde, et nous avons surtout décidé que nos relais communautaires vont être aussi professionnalisés et salariés. Parce qu'ils étaient des volontaires et donc c'était difficile d'organiser cela. Ça, c'est le premier engagement. Le deuxième engagement, c'est que on s'est dit, oui, les financements internationaux vont diminuer. On ne peut pas compter seulement sur les trésors publics. Et nous avons obtenu, en RDC, de lever une taxe sur tous les produits importés. Tous les produits importés, sauf les produits alimentaires et de l'agriculture, vont être taxés à 2%. C'est une décision prise et qui s'applique à partir du mois prochain. Nous allons donc comme ça financer le système de santé en partie avec les produits importés. Et ce financement va permettre de résoudre 3 problèmes. Premièrement, améliorer la qualité de l'offre de soins, mais deuxièmement, approvisionner un médicament essentiel. Et pour les maladies chroniques, nous avons décidé de choisir quelques molécules essentielles qui peuvent résoudre le problème de l'hypertension, qui peuvent résoudre le problème du diabète. Et ces molécules-là vont maintenant être achetées dans le cadre de ce financement. Et ça nous permettra de résoudre un grand nombre. Après, on verra pour les malades compliqués, qu'est-ce qu'on peut maintenant rajouter. Mais au moins réserver quelques molécules essentielles à ces traitements-là. Et surtout, maintenant, nous avons décidé la surveillance. Et c'est là le rôle des relais communautaires. C'est parce que nous pouvons aujourd'hui aller de maison à maison pour aller voir quels sont les problèmes de santé qui se posent. Parce que souvent, nos hypertendus, on les voit trop tard. Nos diabétiques, on les voit trop tard. Donc, notre idée, c'est de vraiment développer les relais communautaires. Nous avons décidé d'avoir 40 000 relais communautaires, chacun s'occupant de 500 ménages, et chaque ménage composé d'à peu près 6 personnes. Ça fait que chacun s'occupe de 3 000 personnes qu'ils surveillent à longueur d'année. Les adultes, on prend leur tension, on vérifie leur taux de sucre s'il y a déjà des indices. Et pour les tout-petits, on surveille toutes les autres maladies liées à leur âge. Donc, la surveillance. Mais surtout la digitalisation, parce que ce qui nous manque beaucoup, ce sont les données. Et on a souvent des estimations au niveau mondial, mais nous n'avons pas souvent des vraies données. Et donc, nos relais communautaires vont être digitalisés pour que nous puissions avoir des données essentielles. Ainsi, nous allons nous engager dans la généralisation du paquet de soins pour les maladies chroniques. Voilà ce que je peux dire en résumé pour aujourd'hui. Merci beaucoup.
Minister Kemba, thank you very much for that. And I will just summarize the powerful statement I have to say for this English translation. Mr. Kemba announced 4 transformative commitments. First, the DRC will scale up the WHO Essential NCD package to reach 50% of health zones by 2030, beginning with hypertension and diabetes. These ambitious plans include training 10,000 additional primary healthcare workers by 2028 and ensuring consistent availability of essential medicines and diagnostic tools by 2027. Second, the government will dramatically transform NCD financing by increasing the allocation of tobacco and alcohol excise tax revenues from just 2% currently to at least 50% by 2027. These substantial resources will flow through the Health Promotion Fund to directly support prevention and treatment services. Thirdly, the DRC will establish robust national surveillance through its first comprehensive WHO STEP survey by 2026-27, creating integrated data systems with regular transparent progress reporting for accountability. And fourthly, the minister announced a progressive elimination of user fees for essential NCD services in 25% of health zones by 2030, prioritizing vulnerable populations through carefully phased implementation with pilot programs and transparent facility compensation mechanisms. These are, I'm sure you'll agree, concrete commitments. Thank you. And I should just point out they are backed by specific financing mechanism operations, if I can say it, which demonstrates the DRC's determined roadmap, really, towards that universal health coverage and effective NCD control. Minister Campbell, we are grateful. Thank you so much for sharing that with us. Another round of applause, please, if we can. Now, I think, it feels very inspiring, and I think let's continue with that inspiration because I'd like to invite Dr. Ouma Oluga, Principal Secretary of the Ministry of Health in Kenya, for an address, please. Thank you.
Thank you so much, and good afternoon to everyone. First, congratulations to Dr. Roger Kamba. I think I have had the opportunity to work with him, and he means business. So thank you so much also to other countries and the commitments that we have. So from Kenya, we are very aligned when it comes to our international cooperation and strengthening our partnerships around financing for NCDs. First and foremost, Kenya was one of the first countries to join this movement, and I think we chaired at some point. And secondly, is that our healthcare is undergoing reforms, and part of those reforms is to strengthen and to sustain financing for NCDs. And I'll just take a minute to give us this overview of how Kenya's healthcare system looks like. One is that we are reforming our health financing. And in the health financing, as with everyone else, we want to rely on our own money. And so domestic resource mobilization is key for us. And we have two pathways to mobilizing resources at the domestic level. One is based on taxes, including some of the health tax or the sin tax. And of course, on the other bit is the contribution. And so when it comes to the taxes, we have established two funds that are key and that are focused on NCD financing. One is the Primary Healthcare Fund. And the Primary Healthcare Fund, we have put in around $130 million US or 13 billion Kenya shillings. And this is going directly at the lower level facilities, that is the level 2, level 3, and level 4, for the screening of NCDs. And we are ensuring that at the bottom, we can have a robust, publicly funded primary healthcare system that is not just treating or identifying NCDs, but are also preventing NCDs. And on the prevention mode, we have employed 107 community health promoters. And these 107,000 community health promoters are people that are from the community, trusted by the households, and each of them are responsible for 100 households. Now, what they have done so far, in 3 years, we have had 48 million screenings for diabetes. We have had 25 million screenings for hypertension. All of this, we have had around 990,000 people referred to health facilities because the person trusted who lives with them in the community, responsible for 100 households, has found the high blood pressure or diabetes, or has encouraged them for cervical cancer screening. Cervical cancer is a big problem in Kenya, and has referred them to the facilities. And we have now just integrated mental health in part of the screenings that the community health promoters are doing at the household level. We've just given them a guideline and a tool, and we've trained them on how to do it. At the hospital level, in terms of the treatment, we have established the Emergency Chronic Critical Illness Fund, dealing with cancer care, dealing with the chronic cases of mental health, which sometimes get admitted for very prolonged period of time, dealing with the issues around complications of diabetes, hypertension, cancer. And we put in $80 million US from the taxes just into this fund. And then, of course, a number of interventions at the hospital level that are being financed from the contributory fund. The contribution are from those who are employed. We take 2.75% of the salary because we want to make sure that healthcare is at the center of economic development, and that employers and employees do understand that without financing their healthcare, they may not wake up the following day to be energetic enough to go back to work. And so we are very keen to make sure that our population understand this. So that's on health financing. Number 2 is on the health workforce. And on the health workforce, we are key to make sure that we have health workers who are fit for the healthcare system, not just fit for the healthcare system, fit for what the people need. And my colleague from Indonesia talked about the people-centered healthcare, so that there's a mind shift in terms of how they treat people at the community level. And number 3 is availing commodities. and the health products and technologies, we are implementing a national equipment service program which has within it 7 lots, including specialized laboratory for diagnosis of NCDs, but also imaging, CT scans, MRIs, and also there are components that relate to cardiovascular services, all of this related to performance of the healthcare system as far as availing technologies that are meant for NCDs are concerned. And with that also, we are signing a lot of partnerships. We just signed with Roche a partnership to reduce the cost of Herceptin by 2/3. Herceptin is one of the medicines that we use for breast cancer that are tested positive for estrogen or for hormones. And I think we are doing all of these things so that we make sure that our healthcare system responds to NCDs and that we respond to those who already have, but also we are preventing the pipeline. And the last bit is we're unifying the healthcare system through a data platform. So the digital health superhighway that we have implemented to make sure that our data is verifiable, it's accurate. It has identities, identity for the patient, identity for the hospital, identity for the health worker, identity for the product. And I finish by talking about we are committed to walk this journey with the world. We are committed first and foremost that as we do all of these things, we want to do a pharmacy benefit package that is specific, and it will have delineation for NCDs. And we are doing this by March of 2026. We will have a pharmacy benefit package. It is now in the pipeline. We're just separating the cost so that we know how we embed it within our health financing architecture. Number 2 is that we are scaling how we decentralize screening and treatment, and we already have a mechanism and a structure that is simple and that reaches the community through our community health strategy, the community health promoters, and the facilities that we have grouped them into what we are calling the primary care network. So we have 315 primary healthcare networks. That is a hospital at a hub and surrounding facilities as a spoke. And we are making sure that we use this to decentralize screening, treatment, interventions, follow-up. And the last bit is that we want to work with the community, international community, particularly starting with our region. We have you've mentioned EXA, we've mentioned the East Africa community, we've mentioned the AU, and at that level, we are ready to champion, but also to work with all others in availing commodities through pooled procurement, through local manufacturing, through mechanisms that can reduce the cost of care and that can rally the whole world to spotlight on NCDs. Thank you.
Thank you so much, Dr. Aluga there. Now let's hear from the Ministry of Health in Tanzania with Dr. Omari Said Ubuguyu. Thank you.
Okay, good afternoon. It is very unfortunate that our minister couldn't make it, not because she missed the visa, but she is contesting for the parliament because we are closer to our general election in October this year. So she couldn't make it with the delegation. And we have Deputy Permanent Secretary as head of a delegation from Tanzania. Unfortunately, has been hooked with other commitment. So I'm representing the Minister of Health and the United Republic of Tanzania. I think we've said it all. As a colleagues, we concur with all our other colleagues what have said in this ground. Just to add a few from the commitment in Tanzania. One, just to make sure that we sustain the gain that we have, because in most cases we forget that there's a lot of achievement that we did and concentrating into new things and lose all the momentum that we have gained. So as a country, we are committed to sustain the gains, and we are sure that together with our colleagues in East Africa, in SADC and African Union, and in the globe as well, that we will embrace all the achievement, we embrace the partner that we are working with. And again, the second one is to make sure that primary health care level or community is given much more opportunity to excel. In Tanzania, we are using direct health facility financing, meaning that the planning is from the grassroots and the finance also comes from the grassroots. At the central level, we just give them priority and a strategic direction. So all the plannings are done based on the data. We have a challenge with the data. We can attest that because we are using DHIS2, and sometimes there is a mix between number of attendants and number of people. So sometimes there is some confusion, but all in all, it gives us the maximum number for projection, which isn't much bad because we get more than what we have. Again, we have very strong medical store department which centralized all procurement and logistics as related to health commodities. Most of the interventions are done through MSD, and I believe with this initiative we can have very strong centralized procurement and logistics mechanism within the region. And lastly, we call upon all our colleagues now to empower people with lived experiences because they are the ones who can drive agenda. For us, it is just a workplace. For others, it is survival. So for them to take a lead will guide all of us for the best interest of those who are living with the condition and the world at large. Thank you.
Dr. Ubagu, thank you so much. It is really central to what we're talking about here today, which is people with lived experiences. Now, Dr. Kapulongwe, Director General of the East Central and South Africa Health Committee, was unfortunately unable to join us today, but really wanted to share some remarks. So Dr. Kimberly Green is going to do that on his behalf. Thank you.
Yes, and just very briefly, and I really want to acknowledge Dr. Oluga and the commitment from the very beginning with the coalition and your interest in participating as part of EXA on more regional or continent-wide efforts towards NCD financing and access. So EXA, who are not able to be here today, they are very strongly committed now moving forward. They represent nearly 300 million individuals across the continent. They are committed to establishing a platform of cross-learning for NCDs, but also very importantly towards forecasting so that there can be better negotiating power for countries in Africa for purchasing NCD medicines. So initially, Kenya and Tanzania will be a part of this regional effort, but they're looking to expand. So I would just say the big congratulations to EXA. We need these regional approaches, and we look forward to hearing more from them. And how they will be partnering with the coalition and with all of us in the room. So thank you.
Thank you very much, Dr. Kimberly Green there. Now, to close today's discussion and reflect on everything we've heard, which is quite a lot, isn't it? Which is great. I'd like to invite Ellen Jaeger, the Senior Vice President of Corporate Strategy and Sustainability at Novo Nordisk, to address us. Thank you.
Super. Thank you so much. It's an honor to be able to close this important discussion we've been having here today. I would like to begin by expressing my heartfelt gratitude to our fantastic speakers, to our fantastic moderator who has helped us through this event and also last minute coming in and doing it with such flair. I would also like to thank our hosts and co-hosts. And that is a few organizations that have come together to make this event happen. That is the government of Denmark, government of Brazil. It is Access Accelerated. It is IGBA. It is PATH, and it is the Coalition for Access to NCD Medicines and Products. Thank you very much for bringing us together here today. So from Novo Nordisk's perspective, this dialogue could not come at a better place and a better time. So for over a century, we have worked to defeat serious chronic diseases. We have focused on diabetes and obesity in particular. Over these last 100 years, we have seen significant breakthrough in innovation, but we do still see barriers. We do still see barriers to actually access this great innovation that we have. But we are therefore proud that we are actually the founding members of the NCD coalition, and we are working towards improving some of this access to medicines and products. And more recently, we actually joined the Access Accelerated, which we're very happy to be part of. And there we believe that we can actually address some of this critical funding issues that we see when it comes to NCDs. So we're very happy to collaborate on that. And that, of course, shows our steadfast commitment to making health equity a bigger focus, but also making sure that we have sustainable access for all. And we're not quite there yet, but we're working on it. But reflecting on today's discussion, I think that I'm deeply encouraged by the examples we've heard today. I think we see a lot of progress, and it's really fantastic to see all these country examples of what is actually changing on the ground. And I think this political will turning into actual action is fantastic. It's something that we really need to see more of. And whether that is within prevention space or that is to get more local healthcare providers on the ground, or if that is finding sustainable financing models. I think we've heard a few of those activities today. I think that is really where we need to see action happen. But I think it's our collective responsibility in this room to join forces and find better ways to work together and find coalitions to actually help change the game when it comes to NCDs and changing the access gap that we see today. So I invite you all to join us in some of these partnerships, and because I believe that no single company, government, or organization can do this alone. We need to hold hands. And I do believe that many of us here bring unique strengths to the table, be that with data, be that with financing options, be that with implementation expertise, be that with, you name it. I think we all have different skills that we can bring to the table, and we need to leverage that. And let me end by thanking you all for your insights, for your deep commitment, for the engagement that we have seen through this UNGA. It's actually my first UNGA, and I must admit I'm really impressed by what I see, and especially in this session here today. And as someone said at another meeting yesterday, in a year when global health is being challenged, even staying the course demands courage. But after listening to you all here today, I am convinced that we can do more than that. We can raise the ambition, and we can show that progress is not only possible, but it's actually essential and a true mark of our collective resilience. Thank you very much.
Ellen Jäger, thank you so much for that. I'd like to, as we close, just invite all the panelists and speakers that have been here with us today for a photograph before you leave. But on behalf of myself, thank you so much for being part of this really important, vital conversation. And I hope you found it as productive as I have. So thank you very much for your attention. Thank you.